Good afternoon, everybody. My name is Heather Korbulic. I'm the Executive Director of the Silver State Health Insurance Exchange, and we are thrilled to be presenting you with our 4th annual Open Enrollment Prep Session for Plan Year 2021. We are being joined by multiple tens of people. I guess we're 111 folks who are joining so far. We know we will probably have some more attendees joining as we go along. So thank you again for being here. I want to get through a few housekeeping items before we get too deep into the weeds on this presentation. First, everybody's microphone is muted and will remain muted for the duration of this presentation. We're going to cover a lot today, but it is likely that you will have questions. So please use the chat feature or the question and answer section to ask your questions, and we'll try to hold some time at the end of this presentation to answer anything that isn't covered in the presentation. We're going to record this presentation and we'll make it available on our website by tomorrow, and we will send a link out to everyone who has joined today. Please share that far and wide. We also want to let you know that if there are questions we can't get to during the presentation, we will make sure to answer them and include them in the email that we send with the link to this presentation. We have a huge crowd, and so again, thank you for being here, and I'm ready to get this party started and want to start with a message from a big fan of Nevada HealthLink and of the work that you do. Let's make sure I can get that going. We did have a little bit of a technical problem earlier, so hopefully we've worked that out. Just 1 second.
Hello, and thank you for attending this important training session to help Nevadans get covered. The work that all of you have done throughout the coronavirus pandemic has helped thousands of Nevadans access affordable insurance. And I want all of you to know how important it is to continue that work during open enrollment. We are still in the middle of a global health crisis, and now is not the time for Nevadans to go without coverage. As you all know, the open enrollment period this year has been extended and now runs from November 1st until January 15th. During that time, consumers will be able to sign up and enroll in health insurance plans for 2021 through Nevada.
My apologies, I pressed
healthlink.com. I'm so glad that our state continues to offer comprehensive, affordable coverage options, especially for the many Nevadans who have lost their jobs or are facing hardships related to COVID-19. Thank you all for taking the time to attend the training. Your expertise will help give Nevadans the peace of mind that comes with having quality health insurance during these difficult times.
So big thanks to Senator Cortez Masto for her kind of persevering support of Nevada HealthLink and the work that you all do. We have a pretty robust agenda today. We want to go over some information about who we are, our mission, and then provide you with some context of where we were for Plan Year 2020. Then we'll get into some information about Plan Year 21, including some important dates, information about renewals, open enrollment, information like carriers and all of that kind of good stuff. We'll be talking about Medicaid account transfers. We'll be talking about we'll give you a sneak peek of our ad campaign for this next open enrollment period. We'll also be talking about enrollment challenges this year and the insurance landscape in a COVID world, and some updates about what's going on in the health policy space. And of course, at the end, we'll talk about why it is that we need your help and how you can go about helping us. So with that, it's important to make sure that everybody knows that really our exchange mission statement is the first 6 words of this: increase the number of insured Nevadans. We can't do that without your help. And we know that having an insured Nevada means that we have a healthy citizenry, and it builds on our public health, it builds on our well-being, and it builds on the state's economic well-being. There has literally never been a more important time to get connected to comprehensive health insurance. And as I will probably say multiple times today, pandemics are a very bad time to be without insurance. Informally, our mission statement looks a little bit like this, and this is where your role comes in. Insurance is confusing. Your expertise is one of the most critical components to connect people to affordable, comprehensive insurance that helps, and then to also help them understand how to use it. I can't adequately express how thankful the staff at the exchange are, Governor Sisolak and Nevada lawmakers, and how much we appreciate the work that you do. We know it doesn't get a lot of attention, but we also know how critical and crucial it is, and we value you and your time. The exchange is really a Silver State Health Insurance Exchange is the state agency that runs and operates our online marketplace known as Nevada Health Link. Nevada Health Link, of course, connects Nevadans who are not insured by their employer, by Medicaid, or by Medicare to the comprehensive qualified health plans that are on our portal. Individuals can purchase ACA certified QHPs or dental plans through the exchange. And if they're eligible, they can get subsidy assistance to help them pay the premium costs. The exchange is the only place that consumers in Nevada can get those subsidized assistance. We are a state-based exchange as of last year. Many of you know that we went through a pretty significant project to transition away from healthcare.gov, and we're now operating as an autonomous state-based exchange located at nevadahealthlink.com. Very important to note during this budget crisis time for the state, Nevada Health Link is a self-funded state agency. We do not accept any state or federal funds to support our operations. So now that you know who we are, let's start talking about where we are and what's coming. Where did we end up for 2020? As you can see, after a successful transition from healthcare.gov, had some bumps, but we appreciated all your patience. Here we are with 77,410 enrollees. 54% of those were female, 46% are male, and the bulk of those folks are between the ages of 35 and 54 years old. Most of our consumers are in silver level plans. A big significant chunk of them are also in bronze. This past year, the consumers who took action, meaning they actively enrolled, they got online with either your assistance as brokers and navigators, or they did it themselves, was 45,698 consumers. There was 31,000 Nevadans who just passively enrolled or let their auto renewal job run and stayed in the plan that they had from the year previously. 80% of our consumers get subsidy assistance with advanced premium tax credits, and another 41% of those folks have plans that allow for cost sharing reductions. As you can see, our enrollment has had a bit of a roller coaster ride year over year. There's never really been a consistent year on the exchange. We do know that there's a lot more work for us to do. Before the pandemic, there were at least 100,000 Nevadans who were uninsured and who were likely eligible for Nevada Health Link and subsidies on the exchange. I'm guessing, we're all guessing, that that number has likely grown due to unemployment rates remaining high and people losing access to their employer-sponsored plans. We also know that there are a lot of people who are starting to realize that the COBRA coverage that they purchased when they lost their employer-sponsored coverage is very expensive and prohibitively so. So we're working on finding all of these people, and we need your help. Like I said before, it's a bad time to be uninsured. This is a picture of our current enrollment breakdown and the geography of that enrollment. I'm not surprised to see that the bulk of our enrollment, 51,000 plus folks, are in Clark County. The second largest area where we have enrollees is in Washoe County with a little over 10,000. So now that we know where we were, let's talk about it being go time. It is time for the second open enrollment on the state-based exchange platform that we built this last year, and our 8th open enrollment as a exchange in the state. So October 1st was a very important date for us, and hopefully you're all aware of that date and have taken advantage of window shopping. All of the plans that are available for exchange consumers as of November 1st are on display on our website at nevadahealthlink.com. Consumers or brokers or navigators can go in and do anonymous plan comparisons. They can narrow into different locations. They can take a look at different income ranges. They can get an idea of how much subsidy will be available to a consumer. And it's open to everyone. It's not just our existing consumers. Another really important date is next week. We are starting to run our auto renewal job. That will run between the 14th and the 20th. And we expect to have notices of renewal dropped into consumers' inboxes around October 16th. November 1st is, of course, a really important date, and that's when open enrollment begins. Many of you are probably licensed in other states or know that the federal healthcare.gov open enrollment period runs from November 1st through December 15th. However, because we can and because we think it's the right move for Nevadans and making sure that we get as many Nevadans covered as possible, the Exchange's Board of Directors voted a few months ago to extend our open enrollment period from November 1st through January 15th of 2021. Consumers who enroll through 11:59 p.m. on December 31st will have a coverage start date of January 1st. For anyone who enrolls between January 1st and January 15th, they'll have a coverage start date of February 1st. We'll also be making a grace period, not something that we will be promoting, but consumers who started their application on January 15th, who were at least started but had not completed their enrollment, will have an additional 5 days to complete their enrollment. So they will have until January 20th to finish that enrollment. As I said earlier, we're running our renewal job next week, and most of our consumers, I'm happy to say, have opted into auto renewal for plan year 21. Consumers will know about that renewal and the plan that they've renewed into when they get their renewal notices in their inboxes by mid-October. If a consumer's existing plan for 2020 doesn't exist in plan year 2021, we will crosswalk them into a very similar plan. Consumers who have renewal notices delivered, or, like I said, they will have those renewal notices in their inboxes by the 16th. But I want to emphasize this point to all of you. We always encourage, in fact, every time I have an opportunity to speak with the press, or Janelle, our communications officer, speaks with the press, we make sure to hammer the fact that it's so important to shop the market. This year of particular interest is that we have new plans, we have new carriers, and we have new rates. So it's critically important to take a look at what's on the exchange for this plan year and find a plan that's right for you and your individual needs. I'm very pleased to share the news with you all that this year we're excited to welcome 2 new carriers to the exchange for a total of 50 qualified health plans on exchange this year. That's almost double where we were last year. This year, Health Plan of Nevada, Silver Summit, and Anthem will be returning to the exchange, and our new carriers, Friday Health Plans and Select Health, will also be joining us. All of the carriers have catastrophic bronze, silver, and gold plans, and Clark County and Nye County will be able to choose from all 50 plans and will be able to select from all 5 insurance carriers. The counties of Washoe County will be able to select from 45 plans. Those will be from HPN, Silver Summit, Anthem, and Friday Health Plans. Then the rest of our counties, the 17 other counties, will be able to select from 35 plans that are available through Silver Summit, Anthem, and Friday. That's big news for those folks who were looking at having bare counties just 3 years ago. We're very excited to be offering much more selection for those folks out in those counties. Also glad to announce that we will have 21 qualified dental plans available. We have 6 dental carriers who are returning this year, no new dental carriers, but I want to remind everybody that the exchange this last year was able to create new rules that allowed for consumers to purchase a dental plan without also purchasing a corresponding health insurance plan. So please remember that that option is available, especially those of you who are doing Medicare enrollments. Oftentimes individuals who purchase Medicare plans don't also have dental. So we are happy to announce that those dental plans can be purchased as a standalone product and do not need to be bought at the same time as a qualified health plan. The final average rate and change on the exchange was 4.2%. That increase is an average across the returning carriers. So important to note that some carriers probably had a lower rate increase, some probably a higher. This is an average. And also important to note that any of the consumers that you work with who are subsidized or who get subsidy assistance will see very little to no impact as a result of that increase because their subsidies will go up in turn. We're so excited to be working with 8 different Navigator grantees across the state. Very thrilled about all of the work that they've been putting into surviving and thriving in a COVID world. And we're so excited also to be joined by 5 broker grantees who have received grants to help them set up storefronts and to use and create marketing and promotional material to generate attention around Nevada HealthLink's open enrollment. Some of you may or may not be aware, but I wanted to share some of the way that we work collaboratively with the Division of Welfare and Supportive Services as it relates to account transfers from Medicaid. So if someone comes to Nevada HealthLink and they fill out an application and it looks as if, based on the information they've provided, that they may be eligible for Medicaid, we will send an account transfer to the Division of Welfare and Supportive Services that basically allows them to do a Medicaid check and determination. And basically, if someone is determined Medicaid eligible after that, they get noticed by Medicaid and they go on their Medicaid way. The same is true if someone applies on the Division of Welfare and Supportive Services website. If they apply and Medicaid determines them ineligible because of being over assets, meaning they have more money than is allowable in order to receive Medicaid benefits, then DWSS will send the exchange and account transfer. And basically what that does is it populates an application on our platform, and we send a letter to those individuals that has a code that allows them to claim their account. So they can come to Nevada HealthLink, claim their account, and fill out the rest of the application and get enrolled. I wanted to point out one change this year that I hope will be a pleasant and welcome change for many of you. Nevada HealthLink has made some changes for not only this plan year, but moving forward into future plan years to use the self-attested information from consumers who reported an LPR or a lawfully present resident status within the last 5 years. And we will just process their application on the exchange without going and requiring a Medicaid reassessment. So now to sort of the fun part for me, we've got a whole new campaign and I'm excited to show you a sneak peek of that in just a moment. But this year's theme is reasons. We're really getting into what's your reason for having health insurance and really looking at the different reasons that Nevadans choose to get covered or the reasons they need to get covered. We're looking and emphasizing how important it is to get comprehensive coverage, especially those that have the 10 essential health benefits on the exchange. We're also going to focus on the fact that 4 out of 5 Nevadans get access to subsidies and are eligible for subsidies. We're going to go focus on single moms. We're focusing on families, people who are searching for jobs, people who have had an injury. We're going to look at cost comparisons and talk about a checkup. We're also going to be talking about people who are self-employed, and then an anthem video, and that's not the insurance company, that's a banner ad that we put together really emphasizing the campaign of the reasons why people get connected to health insurance on Nevada HealthLink. We will, of course, be doing traditional TV campaign and really kind of beefing that up after the presidential election is over because it is expensive and hard to compete in a presidential landscape. So those TV ad campaigns will run around November 4th. Our outdoor, print media, content media, social and digital media will all begin around October 19th. We've done some really great work to our website to update it, and we have a Spanish website that will run through open enrollment period, and the same is true, of course, for the improvements that we've done on our English language website. We have really been working closely and just loving developing relationships with our stakeholders in our outreach wing throughout the last years. So we'll be, of course, focusing on your assistance to cross-promote and to do consumer education and outreach. That really primarily our outreach efforts are done through our navigators and our brokers, of course, and our community partners. We're navigating this in a digital world, and so I really would encourage you to connect to and follow us on social media, share our YouTube videos on your websites, and make sure people are aware that it is open enrollment and that you've got to get connected. We are already starting our public relations and media blitz and have had lots of different conversations with press who's been interested in hearing about our window shopping that will again cycle through when we get to open enrollment. And we have, we'll be doing our press conference to announce open enrollment on Monday, November 2nd, and that will be on Zoom. This has just reminded me that I wanted to also share that, of course, November 1st is the first day of open enrollment, and it is a Sunday, and it is also the day that we have daylight savings time change. So please be aware, and we look forward to doing a lot more promotion when we get into November 2nd and throughout that week. I'm going to share with you a small clip of all of the ads kind of compounded into one brief video to show you and give you a taste of what you'll be seeing on the airwaves here soon.
We enroll because we can't afford to let a sudden injury empty our bank account. Whatever your reason, we're here for you.
The reason I enroll is so I can get covered and stay covered, even after I get back on my feet.
Whatever your reason, we're here for you.
The reason I enroll is so that when he's sick, going to the doctor doesn't have to be a difficult choice.
Whatever your reason, we're here for you.
The reason I enroll is so my asthma, it doesn't ever keep me from working.
Whatever your reason, we're here for you.
La razón por la que me inscribo es porque mantener mi diabetes bajo control no debería controlar la forma en que vivo.
Cualquiera que sea tu razón, estamos aquí para usted.
I enroll because going to the doctor shouldn't be a difficult choice.
The reason I enroll is so I can get covered and stay covered, even after I get back on my feet.
Because we can't afford not to be.
Because I can't let my asthma keep me from working.
Or keep me from living my life to the fullest.
Whatever your reason, we're here for you.
So as you can see, that's a whole new campaign, and we're so proud of it. We really hope it speaks to Nevadans, especially during this kind of unknown time, and make sure that they understand the value of getting connected to Nevada HealthLink and the comprehensive benefits on the exchange. And while we are mostly excited about the good news that's coming for plan year 2021, just like every year of the Affordable Care Act, we will not be free of challenges. And so I thought we would take just a little bit of time to talk through all of these challenges. The first is, of course, the obvious illness, the COVID-19 pandemic that is spreading across the country. So we have been working very hard with all of you to make sure that you have the capability to enroll people via phone or through Zoom or through FaceTime, and ensuring that if you do choose to open your offices for in-person enrollment, that you're taking all the necessary precautions to protect yourself and Nevada consumers. We also are making sure that we have the ability to work remotely. Our staff has been working remotely since March, and that's going very well. Our call center, who has been hiring Nevadans to work on the phones during open enrollment, has also been working remotely. So we're just like every other business and organization trying to survive and thrive in the COVID-19 pandemic. But we want you to know that if there are ways that we can coach you or can help you get connected to the technology to help enroll over the phone or remotely, we are more than happy to provide that to you. We also have a hearing on the Affordable Care Act. The Supreme Court will be hearing the ACA repeal or the Texas versus Azar case on November 10th, which is of course not convenient timing in terms of open enrollment. That will, generally speaking, probably make some confusion. And so I really wanted to provide you all with some messaging about Plan Year 2020. The Supreme Court will hear this case on November 10th, but they will not make decisions for probably 6 months at least after. So generally speaking, that's around June or July of 2021. And it's important for consumers to know that nothing is going to change for Plan Year 21. So getting insurance and getting covered with subsidized and affordable and comprehensive benefits is critically important, and anything that the Supreme Court is doing will not impact Plan Year 21. Obviously, it's an election year, and we talked about what that means in terms of our ad campaign, but it also has huge implications for health care, health insurance, and sort of the future of the Affordable Care Act, and will really be decided on November 3rd when the presidential election is decided, assuming it happens on the 3rd. So there's a lot that could happen one way or the other, and we are, of course, analyzing all of those impacts and trying to assess what we can do to support Nevadans and you all if and however that plays out. It's probably no joke, or no joke. It's probably no secret to any of you that Nevada has experienced historically high unemployment rates throughout this pandemic. Those unemployment rates have primarily impacted individuals who are in the hospitality industry and who are in the arts and culture industry. So primarily this is unemployment that is happening to people who are in lower wage positions. A lot of them have become insured as a result of losing their employer-sponsored coverage by Medicaid, but of course, a lot of them have also become insured with Nevada HealthLink and are eligible for special enrollment periods if they lose access to employer-sponsored coverage. I wanted to point out a few different kind of policy tech wonky things about the unemployment, federal pandemic unemployment compensation, the FPUC. One thing that happened was that Congress wrote the FPUC rules and basically said that that additional $600 that people were getting weekly up until the end of June was not to be counted as income as it related to Medicaid enrollment. However, it is to be counted as income for the exchange enrollment. And we put out policy information on that on our website and encourage you to keep track of that policy information and keep yourself apprised of that knowledge, because it is a bit of a confusion because it was clearly different for both programs. The same is true for what is currently being referred to as the Lost Wages Program. Nevada has not started providing those funds. I don't know when the Department of Employment and Training and Rehabilitation is scheduled to start issuing the lost wages funds that will be an additional weekly amount for Nevadans for a certain time set. But I wanted to let you know that if you're working with a consumer that is on unemployment and they are getting those lost wages, they will have to count that again as income for the exchange. And again, it will not be counted as income for Medicaid eligibility purposes. That's a mouthful. Okay, so the Medicaid redeterminations, that's just sort of a general umbrella term for what's going on with Medicaid throughout the pandemic. Medicaid has enrolled 14% more folks on their rolls during the last 6 months. That's a huge number of new Medicaid enrollees. And the way that the Families First Act was written prevented states from doing Medicaid redeterminations for anyone who became eligible for Medicaid during the pandemic period. So Medicaid has not been checking or redetermining Medicaid or eligibility since March of this year. They have just started to do and to issue redeterminations, and the exchange is working very closely with them to make sure that we manage the churn that is likely to result from many people getting new redeterminations on their eligibility. So for the month of October, DWSS, or Division of Welfare and Supportive Services, sent out 80,000 redetermination notices to Nevadans. Nevada HealthLink put an insert into each one of those letters that went out that spelled out their potential eligibility for the exchange and provided information about open enrollment. Those folks have to fill out some information in order to either remain insured through Medicaid, or they will be redetermined as ineligible. And as I said earlier, if they're determined ineligible because they have now got too much assets to be on Medicaid, we will receive an account transfer and we'll be welcoming those people to come over and finish their application and enrolling on Nevada HealthLink. The same process will be happening again in November, and in November, DWSS will be sending out about 105,000 redetermination notices, and Nevada HealthLink will have an insert in each one of those too. We're also challenged by something that's become a bit of an old hat, but is just as equally as frustrating as it has been in every year since we started our OE periods. There are these aggressively marketed competing plans. These are plans that are come up in the search for health insurance or Obamacare or Nevada HealthLink, even sometimes, depending on the way that they've finagled it, that lead or mislead consumers to websites that are not Nevada HealthLink and sometimes appear to be Nevada HealthLink, or selling products that will come with subsidies or that are ACA certified. Some of these are plans like short-term limited duration plans or health sharing ministries. I want to caution all of you about those types of plans. They are not required to cover pre-existing conditions. They do not come with any kind of subsidies, and health sharing ministries are not required to pay any of the claims. They have a lot looser rules around them. So again, connecting people to comprehensive benefits on the exchange is the right thing to do, especially considering the public health emergency we're facing. So let's talk a little bit about what's going on in our insurance landscape now that we're living in a COVID-19 world. And as Moira Rose would say, one never knows what may happen. So what do we know for sure? That is nothing. We don't know anything for sure. There's a lot of unknowns as we head into this open enrollment period. We do know that the historically high unemployment numbers and the loss of minimum essential care impacts will be unfolding for not just the open enrollment period, but also into the next year as many Nevadans move from being unemployed to being permanently unemployed, meaning they've lost their, or they're no longer eligible to receive unemployment benefits. We know that that shift is going to be impacting both Medicaid and the exchange, and we're preparing ourselves for that. We know that the stakes have never been higher in terms of what happens with the 2020 presidential election. Depending on who the electorate is, we will face very different realities. And so we are preparing ourselves for either scenario. We're also know that this redetermination process and hold that's been happening with Medicaid will have an impact on the exchange and will likely have an impact on the exchange for several months, possibly even into the spring of 2021. So we know we will start to see churn from Medicaid, and we will have to be managing that. We know that we will continue to see special enrollment growth, not just open enrollment. We know people who are getting enrolled right now because they've lost their MEC or their minimum essential coverage or their employer-sponsored plan, that they're getting enrolled for plan year 2020 right now. And we know that that growth will continue into plan year or 2021, probably even throughout the duration of this next year. So we're preparing ourselves to have a more robust system for special enrollments. We also know that the federal rules have changed around health reimbursement accounts. So many of you who have taken our training and who become certified to sell plans on the exchange are probably remember in our certification, we included information about how to coach individual consumers who have a health reimbursement account from their employer. We're also working on talking to small businesses and employers who are potentially considering no longer providing coverage as an employer or through small group plans, and instead providing health reimbursement accounts or ICHRA accounts to their employees, and what that means for those employees and how to coach them through that. We also know that COVID-19 has had just untold impact on healthcare throughout our state. During the initial shutdown time period, we know that claims were historically low and that doctors were not seeing patients, dentists were not seeing patients, and so the claims have been in flux. We know that they have started to pick up again, that doctors are starting to see patients again, dentists are starting to see patients again, but it's still not at the level that it was before. So that has consequences for hospitals and for providers and for doctors and physicians. And that, of course, will in turn have consequences for our consumers. I also just want to mention that we hope you'll keep your finger on the pulse about how COVID has impacted our state in terms of healthcare, and that you will make sure that the consumers that are enrolling in Nevada HealthLink products understand that tests for anyone who's on an exchange, COVID tests for anyone who's on an exchange products are free, and that they will be covered in any hospital stay that they have as a result of COVID-19. So this is my favorite actor, the one and only Jeff Goldblum, and he says, "Life finds a way," and it is true. We will find our way through this maze of COVID. We've come so far, learned so much already, and we've done that really with help from you and from the work that you do to outreach to consumers and to give them important and timely information. I thought I would spend a few more minutes going over some updates from the state and where we're looking at where we've come to grow in terms of working and coordinating with our sister agencies throughout the state, and then some information about what's coming. We have developed a partnership with the Department of Employment, Training, and Rehabilitation. We're working towards getting a stuffer or a notice into each one of the mailings that they send to unemployed Nevadans who are making claims or unemployment benefit claims. However, that does take some time and coding. So in the interim, all of the folks who work with Dieter in their communications department are helping to promote the open enrollment period and notify Nevadans about subsidies and eligibility through their social media and through their webpage. So we know that there are hundreds of thousands of Nevadans who are paying close attention to the Department of Employment, Training, and Rehabilitation. And so we're very hopeful that that cross promotion will generate some more outreach and interest. We also have been working, like I said, in enhancing our coordination with the Division of Welfare and Supportive Services. We are joined in our mission to make sure that Nevadans don't fall through the cracks, that they get access to insurance and benefits that they're eligible for, and that they are covered not only during this public health crisis, but for the long run. That has all sorts of wonderful consequences. Getting people coverage has all sorts of consequences for ensuring their health, our public health, and our economy's health. We're also coordinating with the Division of Healthcare Finance and Policy, DHCFP, as it's commonly known, on their upcoming managed care organization contract. As many of you are probably aware, many of the carriers that sell plans on the exchange also are contracted to do managed care for Medicaid. So the exchange is working with Medicaid, who will be putting out an RFP, or a request for proposal, for that managed care contract in January of 2021. And so we're hoping to ensure that we can put some language in those contracts and in that RFP that will offer consumers the advantage of being able to stay with the same carrier if they choose, and allow for carriers to help us all do a better job of managing the churn between Medicaid and the exchange. I also sit on the Patient Protection Commission, which is Governor Sisolak's commission, made up of all different fields of health care, and that body has put together some bill draft requests that will go probably into this next legislative session queue of bills to be heard and considered. One of them is related to telehealth and extending access to telehealth outside of just this public health emergency that's been happening and that we've been accommodating during this time period, but taking that out for a more common and regular use for Nevadans. And then the other bill that they've put together is related to all payers claims database, and that would potentially be an opportunity to provide transparency and insight into what hospitals and providers charge for services. And then we also have the upcoming legislative session. This is going to not be a boring one, that's for sure. As you're probably aware, Nevada's experiencing a significant budget crunch. And again, I wanted to point out what I said earlier, that Nevada HealthLink is a self-funded state agency. So we have revenue that will support our operations, and we will likely not see too much in terms of budgetary changes. But we are anticipating a very comprehensive and probably very robust conversation around health policy. And we'll be working towards analyzing bills and commenting on bills as necessary. So now we're to the fun part. We need your help. Please help us. We need your help to reach our goals. Our goal is aligned with our mission. We need to increase the number of insured Nevadans, and we need you to help us make sure that these Nevadans know that we're open for business and that there are very low cost and no cost options that exist on the exchange. We need your help to find people who are not only returning but new, and we need your help with returning consumers. We know there's been a significant change for most people throughout this last year. So we want to make sure that the data and the information we have on file for them is accurate and up to date. and you can help us make sure that's the case. We also want to make sure that we're finding these folks who are uninsured, but also who are underinsured, people who are potentially purchasing plans that are not comprehensive and that don't really have to cover all of the essential health benefits. It's a good time to get in touch with those folks. It's almost open enrollment. We want them to get connected to those comprehensive health benefit plans. We also need your help to connect our community to the good news that exists about the affordability and the rates and the choice that exists on Nevada HealthLink. Please follow us on social media. Please follow us on our webpage, share our content, share our YouTube videos. Make sure you're promoting Nevada HealthLink. We also would really appreciate you encouraging these returning consumers to work with an enrollment professional. We always make sure that's a message that we include in our public relations. Insurance is confusing, and we have all these licensed professionals who understand this market. They understand your individual needs and who can help you connect to a plan that's right for you. And then finally, it's always important that we make sure that consumers are connected to the payment portals on our insurance company's web pages, that we help them set up a monthly payment because you need to effectuate. You have to pay for your insurance to be sure that you're covered. This is my final slide, and then I promise I'll get to questions. I just want to remind everybody that open enrollment runs through November 1st through January 15th. We're, of course, located at nevadahealthlink.com. Please check us out. We've made some great improvements to our webpage this last year. The broker line that's listed here, the broker navigator line, is just for you. It's 1-800-547-8156, and we put that line into operations to expedite the calls from all of you to make sure we can help you as quickly as possible and get you the answers you need to help consumers move through the enrollment process. We have a new email. It's addressed to reach out to our stellar quality assurance team here in our offices, well, at home right now, but with Nevada HealthLink. It's brokersupport@exchange.nv.gov. Again, we focus on responding to that as quickly as possible. That does experience a lot of volume during the open enrollment period, but we are committed to being as responsive as possible. Thank you, thank you, thank you for the work that you do. Thank you for joining us today. And I assume, Janelle, that we have some questions that I didn't maybe get to during the presentation. So if you'd like, go ahead.
Yes, I have some of those. I will read them off to you. Can everyone hear me? A nod from Heather. Okay.
Yes.
All right. From Teresa. If a consumer's income during OEP for 2020 was above the 138% poverty level, but because of increases in the income levels, their unchanged income would be below 138 for 2021, will they automatically be pushed over to Medicaid as a part of the auto renewal if they don't update their application? And when will that data get sent to DWSS?
Thank you for that question. And I'm going to make sure we also answer this in the email that we send out, because I want to make sure we fully encapsulate. But my quick answer to that question is that we are using data that was self-attested and submitted to us in 2020 to run the 2021 jobs. So if someone does not share the updates to their income range, then it will not likely be sent over as long as it's within the relative threshold of that which the IRS deems acceptable. Then that information will not be sent over to Medicaid for a redetermination. That being said, there's probably a whole lot of nuance that's going on there, and I want to make sure I get a really comprehensive answer for you. So what I'm going to do is make sure we get that into the email we send you with the link to this presentation.
Great, thanks, Heather. From Anne. In view of COVID, is it okay to accept electronically signed authorizations since many insureds do not have print and scan capabilities?
Yes, I believe that is acceptable, and I will confirm when we send an email to you.
Okay, that's what I said too. All right. Also, another COVID-related question for the testing, is there a max number of tests that a client is covered for, or are they only covered for one test?
There are no limits, I believe, on tests. I've read that emergency regulation several times, and so no, I do not believe there's any limitations on the number of tests.
Okay. Do you have information on where people can apply to be a remote call center agent for the upcoming open enrollment season?
Yes, and I don't know if they're still recruiting. That's a great question, but our vendor Get Insured was recruiting, and we posted that information on our LinkedIn page at the Silver State Health Insurance Exchange. We also, I know we posted it on Twitter. Did we post it on Facebook, Janelle?
We did, yes.
Okay, so it's on all of our social media pages where you can apply, and I would suggest that you go take a look there, but I want to just put an asterisk here that I'm not sure if they're still recruiting.
Yeah. All right, can you confirm when the Medicaid redetermination is occurring, 10/20 or 10/21?
So it depends, and if we process applications that suggest that a person is now eligible for Medicaid, going and remembering that we're using information that was provided us in plan year 2020, that if we have to send over renewals to Medicaid, that will be done right in that time frame between October 14th and 20th. I have no assurances on how quickly that will be redetermined by Medicaid or determined by Medicaid. I know that they sometimes run up to 45 days. But we do anticipate having significantly fewer renewals having to be redetermined by Medicaid this year.
Okay, and does the exchange have any insight on the number of people who signed up for an exchange plan after being laid off, received tax credits, and may be charged after regaining coverage through their employer?
So you wouldn't, I don't have any specific information on that right now, but if you were entitled because of your income during plan year 20 and you were not employed, or you had such an income or didn't have access to your employer sponsored coverage that would make you subsidy eligible for the exchange, you would, it doesn't seem like, unless you know something I don't, that you would be responsible for repaying those tax dollars because you were legitimately eligible for them for the time period that you collected them.
Makes sense. Okay. Where can we input mock submissions? This is from Mike.
Thanks for that question, Mike. We don't do mock submissions, so those are not accepted and not encouraged at all. So if you want to run through a scenario of a consumer, you can go to our window shopping platform. So just go to nevadahealthlink.com, check out our plans, and you can run through scenarios that way to understand what the costs will look like and the plans that are available to people depending on where they live. But you can't go through a mock application.
He says, thank you, he'll do that. And then we have one more person from Dahlia. Will there be flyers that we can print and post in our health centers? And I can answer that. Actually, we will have all of this information on our media and marketing asset page on nevadahealthlink.com. We will have new resource guides printed, and also those will be available for you in a digital aspect, so you can print your own. Yes.
Thank you. We really appreciate that. Okay, is that it, Janelle?
That's all. Oh, one more, sorry, just came in from Willie. When is recertification for 2021?
In terms of brokers and navigators, it's been going since August. So yeah, we sent out notices and have been requesting people to get that training done for a couple months now. And I appreciate everyone joining us today. Like I said, the attendance has been just stellar. We're really excited about this next plan year and how much real opportunity there is for Nevadans to get connected to these comprehensive benefits. We will be finishing this recording up today and sending out an email tomorrow, and we'll be answering the questions that came to us from the morning presentation along with this afternoon's presentation. And again, thank you for your interest. Thank you for your support and good luck. We're here for you. Call us anytime. Have a good open enrollment period. Bye, everybody.